Hey, Lindy, this is Clay. Here's that video I was kind of talking to you about, kind of put together of Adrian's kind of case today. Again, my intentions are to help people preserve their natural teeth with as little dentistry as possible over time. Whenever a situation presents itself where we need to intervene and remove a cavity or a crack, we like to use biomimetic dentistry, specifically the 6 lessons approach, as I feel like it's the best way to help people avoid root canals and unnecessary dental crowns. Here's kind of the x-ray here. Kind of younger individuals will have a situation where the nerve of the tooth is kind of close to the top of the tooth. And so these cavities just don't have very far to travel before they can cause pain, infection. And so, these steps that we take all kind of hopefully ensure that we can kind of clean the tooth, seal the tooth, and have something that remains problem-free for a long time. And so here's just that first picture where we're doing our first step of isolation. The materials that we use are extremely good, but moisture is not your friend. And so even humidity of breathing can affect these things. And so we're just taking each step and maximizing what we can do to improve upon it to give us the best outcome possible. Second step is going to be, of course, removing cavities, cracks. We do that through this caries detecting dye. Gives us a nice visual to ensure that as we're cleaning the tooth, not only we're removing the cavity, but more importantly, we're staying away from exposing the nerve of the tooth. And so without that, sometimes it can be a little tricky, a little difficult. And so you can kind of see we're just cleaning and placing the dye until we kind of feel like we have a good clean surface around. And so the next step is to, once it's clean, let's say cavity-free, crack-free, now it's about sealing the tooth and rebuilding it. So again, we're using gold standard bonding agents. These are the best on the market. They have 30 years clinical success. No other kind of bonding agent has that. That's that kind of salad dressing analogy I was using in terms of like 2-bottle system versus 1-bottle systems, and just making sure that, everything stays fresh and good. And so when you kind of see this contact lens effect, kind of this shiny glossiness, that's just an immediate visual that, everything is sealed real good. You won't see that in situations where you just don't get a good seal. And so these are just other pictures kind of showing different angles kind of that. But, once we begin that layering process, we're replacing the dentin first. That's kind of like the softer living part of the tooth. So we use very specific materials to mimic that. The Kevlar in areas that's kind of close to the nerve, we'll layer that into that. And so as she's chewing and things like that, again, it provides like a little buffer and, hopefully provide, teeth that kind of, again, can just kind of feel good as well as look good. And so once we layer that second step, we're kind of taking our time. We want chemistry to do its thing. These reactions, faster is not always better. And so, once we allow this material to kind of set, we're going to ensure that we get maximum bond to the tooth. And so you can kind of see, again, it just looks clean. And so, once that dent layer is kind of laid down, we're going to kind of rebuild that enamel part. And so, again, we're going to use other materials that are a little stiffer because enamel is stiff and strong, and kind of shape it so that it kind of looks good and feels good. These are just different angles. You can kind of see if you didn't know where those cavities were, you really couldn't see where our material is. And so that seamless blend, that transition just, again, is a nice way to say that, these seals are good and should be that way for a long time. I thought this case came out really good. Hopefully it will translate into feeling good for Adrian. I know y'all had some frustration in the past with other teeth, kind of leading to other problems. And so again, everything that we do from the education we take, the time we take, the materials we select are all to provide patients with, kind of painless dentistry with preservation in mind, avoiding root canals and what I call unnecessary dental crowns. And so hope you found value in today. And if you, kind of have some friends, family, that have been told they need some dental work, could be, fillings or crowns or maybe a root canal, to appreciate you, keep us in mind, and, maybe see if they can kind of give them a second opinion, see if they could benefit from biomimetic dentistry. So, again, enjoy today. Hope you found value in this. If you need anything, let me know, and take care.